Coming out of lockdown, going into new tiers, and now news of a vaccine has prompted questions from you, thank you for those, that we said we'd put to two of London's key figures, the Mayor Sadiq and Professor Kevin Fenton, London's Public Health Director. Welcome to you both and thank you for joining us. Let's try and get through as many of these as we can. But before we start, Professor Fenton, very quickly, for those people at home watching now, just tell us, how will they be told about when and where they'll be vaccinated?
So the details of the implementation are still being finalized, but those who are in the priority groups will be informed either in their care homes or by their general practitioner so that they will have a good sense of preparing for vaccination and their timing as well. So again, the details are still to be worked out, but watch the space.
OK. And on that subject of vaccination priorities, this question we got from Jessica.
My husband is 36 and has motor neuron disease. He already has respiratory weakening and has been told that COVID would kill him. Our 5-year-old son has missed most of his schooling this year in order to keep his study safe. My question is, will you allow clinicians some flexibility to vaccinate their patients with the greatest risk of mortality first, so that children like our son are not left choosing between their education and their parents' life for a week longer than necessary?
Professor Fenton, can you answer Jessica?
Yes, and I really understand the challenge that Jessica has just outlined. There are strict guidance which is being developed for government by an independent committee looking at vaccinations, and that really setting the priorities and the prioritization for the vaccines. Now, as we have more experience with the delivery of the vaccine, as well as getting it to the highest risk groups, then I'm sure there will be an opportunity for us to look at how we further enhance the implementation moving forward. But at the moment, we have to stick to the guidelines which are being developed by the independent scientists advising government.
On that note, if I can turn to you, Mayor Khan, we know that there is some flexibility to take into account other factors like deprivation, ethnicity and professions. Given the makeup of London, who decides locally about allocating vaccines to these other groups at risk?
Well, at the moment, we're still lobbying the joint committee that Professor Fenton referred to about this flexibility that you mentioned. We do know that those who work in care homes and those who work for the NHS or those in the front line will get priority. We're lobbying the government to also consider others in the front line. Think of transport workers, think of those who work in shops. You heard from the last questioner about some other people who should be getting flexibility. You referred to the fact that we saw during the first wave a disproportionate number of Black, Asian, minority ethnic Londoners losing their lives. And those are some of the things that Professor Fenton, myself and London leaders are lobbying this national joint committee about.
OK. And Sadiq Khan, you have talked about low uptakes of previous vaccines in London in the past. We've got this question here from Annie, and she says, what can you do to reassure me the vaccine is safe for me and my family? And we've had quite a few questions around that. Mayor Khan.
Well, firstly, I mean, history teaches us that vaccinations have saved millions and millions of lives. We're speaking to our grandparents. Smallpox, polio would be major issues of concern. Those have been either eradicated or almost eradicated. The best answer I can give is my mum is probably at the top of the queue in relation to the list of people eligible for this vaccine. And I've already been in touch with her to tell her if she's contacted next week by the GP, she should make sure she takes up the appointment and takes the vaccine. Why? Because it means that she could be immune from catching this virus. Why? Because she's one of the people, unfortunately, if she was to catch the virus, the consequences would be far more severe on her than they would be on me.
OK. But you still accept there is a job to do in persuading Londoners. Professor Fenton, to you, we've got a question here about the level of protection. It's from Tulsi about her grandparents.
It was great to hear the news of the first vaccine being made available for vulnerable people next week. What I would like to know is what level of protection would my grandparents get after the first dose? And does that mean it will be safe for me to see them at Christmas, as they're unlikely to have the second dose by then?
It's an interesting point, isn't it?
Yeah, yes, it is. Now, what's really fantastic about these new vaccines is just how effective they are, and especially among those who are older. And those are exactly the groups that we need to protect. The vaccines which are currently will be available will require 2 doses. So it's important that when you receive the first dose, that you continue to observe the sort of best practices in reducing the risk of both transmitting the virus and acquiring the virus. So ensuring that you're still practicing those hands, face, space, and ventilation guidelines for as long as possible until you have the second dose. So really, the vaccine is important for that.
So in your expert view, does that mean if you've had the first dose and then Christmas comes along and your second dose is after Christmas, you would urge caution against household gatherings and seeing family? Is that what you're saying?
I absolutely would. And that's why the guidelines for the Christmas period, in terms of ensuring that you have support bubbles and following the restrictions over the Christmas period, will be as important whether or not we have a vaccine available. We have to continue to practice those safety measures as well.
And just briefly, before we move on, Mayor Khan, how long will it take before all vulnerable people in London are protected, do you think? Any idea of the timescale there?
It'll take weeks. I mean, one of the things that is really important to get across is it will take weeks and if not months for those we're really concerned about to have the vaccine, but for the entire city to have the vaccine will take a considerable amount of time. And that's why Professor Fenton is reminding all of us, let's not assume because we've had this fantastic news today we can act as we did before March. We can't for a number of months going forward.
OK, let's move on with some questions, because as we know, London is in Tier 2. We've had lots of questions on that. Let's whiz through these if we can. The first one from Pat. She says, some relatives recently caught COVID but successfully self-isolated. If they visit us over Christmas, are we in danger of catching the virus from them? Can they be reinfected?
So again, it's really important that the guidelines for Christmas visiting are followed. If they're in a supportive bubble and if they have been recently infected, then there's little risk of being reinfected in time for Christmas. But really important that the guidelines on mixing are followed.
OK, and in terms of travelling at Christmas, let's hear this question from Matt.
Hi there, thanks for taking my question. I would like to know what the rules are for travelling between tiers within the UK. Thank you. That's
to you, Sadiq Khan.
Well, the best way to think about it is we're in Tier 2. Those in Tier 3 shouldn't be visited. That's the bad news. You really should only be going to another tier if you've got a good reason, a doctor's appointment or for work. If you go and visit somebody in Tier 1, so that's the tier with fewer restrictions, less restrictions, use the Tier 2 rules. So don't assume because you're going to a lower tier with less restrictions, you can abide by their rules. Wherever you go, abide by the Tier 2 rules, but you really shouldn't be going to Tier 3 areas. OK, and can I just pick up Professor Fenton on this, because it's about a support bubble. Wendy says, I live in London in Tier 2, but my support bubble lives in Kent, which is in Tier 3. Can we still visit?
So as the Mayor said, you know, it's really important that you don't travel from a high-risk area into a lower-risk area, if at all possible. But as part of the bubbles and the restrictions for Christmas, there are going to be guidelines as to how best to do that to reduce the risk of transmission. So it's really important that we, both in the run-up to Christmas, practice as much of the preventive measures as we can, and then we move into the Christmas period where we reduce risk by being in the bubbles.
Okay. Let's turn to something that has caused a little bit of confusion. We know that pubs that serve food can open in Tier 2. Here's a question from Peter.
Good evening. Am I allowed to sit outside in a pub garden and have a drink without buying a substantial meal? Also, could you please clarify exactly what constitutes a substantial meal? Thank you.
Mayor Khan.
There's a bigger issue, which are pubs have gone bust and continue to go bust because of lack of support. So we continue to lobby the government for support. But the short answer is no. Unless you're having a substantial meal with your drink, you shouldn't really be having a drink in a pub. And actually, most pubs in London, in fact, all of them are acting responsibly and hopefully won't serve you a drink without a substantial meal. And I think what publicans are doing, the sensible ones, is not looking for loopholes, but realising what a substantial meal is. And I think the fact that we're talking about whether a pork pie is a meal shows how ludicrous the government rules are. But it shows actually a concern pubs have about staying viable during this difficult time. What they need is support from the government rather than mixed messages and confused comms.
And the government would say that, or have said that the pubs do know what the rules are. They've also said there's a lot of support for pub owners. They can furlough their workers, cash grants, VAT and business rates relief, and also the recent £1,000 grant for pubs that don't serve food. But can I ask, just follow up this very briefly. Alan says in Tier 2, can you stay for a few drinks in the pub after you've had your substantial meal?
No, the rules are quite clear. What you should be doing is having your substantial meal with a drink, not having a number of drinks after you've finished your meal. And actually, most, as I said, publicans are responsible, and I'm afraid they'll be advising you to leave unless you decide to have pudding.
OK. And just finally, Professor Fenton, if I can ask you, because we know that these restrictions are now in place in Tier 2, anyway, for London for 2 weeks. What is the trigger point for Tier 3? Because obviously that will be just before Christmas. And we know that there are some areas in London, like Redbridge and Havering, that have very high rates of infection compared to other parts of London.
So we continually monitor the data on what's happening with COVID across the city. And what we'll be looking at is whether we continue to have good control of the virus or whether that numbers and rates of infections are increasing across the city. And that sort of observation, those sort of data will be important in making those decisions on how we move between tiers and what happens as we run up to Christmas.
OK. Well, can I just say thank you both for joining us on this key day as we come out of lockdown into the tier restrictions and news, of course, of a vaccine. We appreciate your time. Thank you both. And, of course, thank everyone at home for getting in touch with those questions. We had many, many of them. Thank you very much.